My name is Wendy Emberson and I'm a physiotherapist at Stort Physio. We're starting a series of videos linked into the alphabet. So as this is the first, this is going to be on the ankle. And this is an ankle. Attaches the leg onto the foot. This is what it looks like from a skeleton point of view. So what we have is the two leg bones coming down here. We've got a bone underneath there called the talus, and then you've got the heel bone there. What normally happens with ankle joints is when you go over, if you've been drinking too much or slip or slide, twist the ankle, is that you damage ligaments that attach onto the side here. And what they're doing is attaching this bone onto that. That's the commonest way of injuring your ankle. So how does that happen? It's when the foot gets turned and twisted like that. So it gaps and strains these ligaments in here and they can get damaged. So bring it back to here. So that's the commonest one. And to look at an ankle, what we do is we look at the range of movement. So we can go up to see what that's like, go down, turn it in, which stresses that ankle, those ankle ligaments in there. Turn it out this way, which is stressing the other ligaments on the other side, and then we go up to there in that position, and then down and in, and then down and out. What we're looking at is this simply a question of the ligaments here, or is there also a problem up the bone? Because it is possible to fracture this bone as your ankle goes over. Or is there a problem with this joint which is underneath the main ankle joint? That's another possibility. So we're looking at that joint. What can also happen is that you can damage the joint in here at the bottom of the fifth toe here and this bone as it joins onto the rest of the foot. There are a lot of different things that you can damage in the foot, and it needs a detailed examination, far more than I've just done now, to determine what and where the injury has happened. What we then do is to say, right, for example, it's the ligament. It's not completely ruptured, but it's still intact and it's perhaps swollen, bruised. We can use acupuncture, we can use interferential therapy, we can use ultrasound, all sorts of techniques to increase the healing rate of those ligaments, which normally, if you do nothing, will take about 8 weeks to sort themselves out. But what we want to do is to restore the normal movement of the joint, the normal length on those ligaments. Most importantly though, we want to get back the stability of the ankle, because the biggest reason for spraining an ankle is that you've done it before. And what happens is there are little sensors in the ligaments, in the tissues there, that tell the brain where you are over your foot. And if you damage those little sensors by tearing the ligament, then you've lost that, what we call proprioception. So your brain doesn't really know where it is over the foot. And that we need to re-educate as well. Next in the series, after ankle, comes B for backs. And we treat more backs possibly than anything else. And I'd really recommend you have a look at that video.